So 10 to 15 years ago, which is everything in my past, I woke up with a little bit of pain in my lower abdomen. And really quickly, it ramped up to a lot of pain. Worst I've ever had. Don't know how it compares with childbirth, but for me, it was terrible. So the guys rolled me into the car, got me to the hospital, found out it was a twisted bowel. 1 in a million. Shouldn't happen, but I won the lottery. Apparently, if it's not taken care of quickly, a colostomy is likely, and if it's even 12 hours, sepsis sets in and you likely die. Folks at Kelowna General got me into surgery within 8 hours. A wonderful surgeon, wish I could remember her name to thank her, took care of it. No after effects at all. 100% perfect now. Last year, February, I went in and got my first knee replaced. They fillet open my leg, rip out the knee, jab a bunch of stuff into the bones for support, and put a new joint in. Zip it up, and 6 months later, you're back good as new, almost. This February, I had the second one done, and we're here mid-April, and I'm almost walking again without the cane. So all of that, and I did a quick Goog. If I was in the States, that would have probably, those 3 operations cost me between $250,000. Up here, because in 1947, Tommy Douglas in Saskatchewan started the first government health care plan you paid into, and in 62 made it a non-pay plan. And then in 1966, Lester Pearson in a minority government spread it across Canada. I pay $0. But understand, that is a privilege, having that universal health care. Ask our friends down south. We need to fight to keep that privilege because people are always trying to take it away from us. In BC here in the aughts, there were medical professionals who thought they could make more money selling directly to the rich, and rich that wanted more privileges. So they went to Gordo mixes a stiff martini Campbell and his liberal government that were actually small c conservatives. Anyway, and they got started on it by public and private testing. You could go and pay to get MRI, stuff like that done. Now, before they could go any further, they were out of government, so that's good. But the next time the conservatives get in here now, be the BC conservatives this time, they don't have to go through that step because that system's still in place. So they can move on to private surgery clinics and stuff like that and form a 2-tier system, one for the rich, one for the poor. I bring this up now because Danny Smith and the UPC in Alberta are doing the same thing. They're decided they're going to allow for pay-for-service testing, and that's just the first part of a slippery slope. Our grandparents and parents fought like hell to get universal health care. We need to fight like hell to keep it, because you know what? At least for me, $0 is a lot better than $500,000.